Welcome to the Burn Aid channel. Thank you for joining us. Today, we'll discuss a life-saving procedure, cardiopulmonary resuscitation, commonly known as CPR. CPR is a critical emergency technique used when someone's breathing or heartbeat has stopped. We'll explore what CPR is, when to use it, the steps involved, and important considerations to keep in mind. What is CPR? CPR stands for cardiopulmonary resuscitation. It is an emergency procedure that combines chest compressions with artificial ventilation to maintain circulatory flow and oxygenation during cardiac arrest. CPR helps preserve brain function and sustain life until professional medical help can take over. When to perform CPR? CPR should be performed when a person is unresponsive, not breathing, or only gasping. It is used in situations such as sudden cardiac arrest, drowning, suffocation, or severe electrical shock. Immediate action is crucial, as CPR can significantly increase the chances of survival. Steps to perform CPR. 1. Check responsiveness. Tap the person and shout, "Are you okay?" If there is no response, proceed with CPR. Call emergency services immediately or instruct someone nearby to do so. Steps to perform CPR, Part 2. To open the airway, tilt the person's head back slightly to open the airway. Check for breathing. If the person is not breathing normally, begin CPR immediately. Steps to perform CPR, Part 3. 3. Chest compressions. Place the heel of your hand on the center of the person's chest, then place your other hand on top. Press down hard and fast, at a rate of 100 to 120 compressions per minute, allowing the chest to rise fully between compressions. Steps to perform CPR, Part 4. 4. Rescue breaths. After 30 compressions, give 2 rescue breaths. Pinch the person's nose shut, cover their mouth with yours, and blow to make the chest rise. Continue the cycle of 30 compressions and 2 breaths until emergency help arrives or the person begins to breathe. Important considerations. 1. Proper technique. Ensure your hands are positioned correctly on the chest and that compressions are deep enough. Shallow compressions may not be effective, while overly forceful compressions can cause injury. Important considerations, Part 2. To use of an AED, if an automated external defibrillator, AED, is available, use it as soon as possible. Follow the device's prompts while continuing CPR until it is ready to deliver a shock. Important considerations, Part 3. 3. Safety. Ensure the scene is safe before starting CPR. If the situation is dangerous, such as a fire or active shooter, prioritize your safety while seeking help for the victim. CPR for children and infants. CPR for children, ages 1 to 8, and infants, under 1 year, differs slightly. Use 1 hand for compressions on a child, and 2 fingers for an infant. Compressions should be about 1.5 inches deep for infants and 2 inches deep for children. CPR training and certification. While basic CPR knowledge is crucial, taking a certified CPR course is highly recommended. Training provides hands-on practice, helps ensure proper technique, and prepares you for real-life emergencies. Key takeaway points. CPR is a vital emergency procedure that can save lives during cardiac arrest. Remember to check responsiveness, perform chest compressions, give rescue breaths, and use an AED if available. Regular training and certification ensure you are prepared to act confidently in an emergency. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the Burn Aid app for free from the Play Store or App Store for more detailed guidance on burn care and first aid.